Friends, it's Dr. Cameron Rockstar. Today, I want to talk about one of the most common questions I get from you guys, and that has to do with the lower eyelids. Many patients, guys, girls, men, women of all ages, all ethnicities, they all have the same complaint. How can I improve the appearance of my under eyes? Under eye circles, dark circles. Lots of patients think that this problem gives them a tired look, like they haven't slept for days or weeks. But really, the answer to this question is extremely complex. And one of the most common misconceptions out there is that the lotions and potions that you buy at Sephora, you buy at your local drugstore, even buy at your doctor's office, your dermatologist, plastic surgeon's office, it's all BS. Don't waste your money. The issue that you really have to understand is what is the cause of your under eye circles, your dark circles? What's the etiology? And that answer is different for every patient. So you need really the help of a good board certified dermatologist who's well versed in this subject to decipher what the reason is that you're having a problem with your under eyes, whether you're tired or you have a dark under eye circle, because there are so many different etiologies. Etiology number one, which is very common in people of many ethnicities, but also very common in darker skinned people, people of Mediterranean descent, Indian descent, and so on and so forth, is a genetic problem where they have hypervascularity. The under eye truly looks purple. It's not dark. When you spread the under eye open, you see a plethora of blood vessels. It gives a purple appearance. That is not going to go away with under eye creams. So a common solution for that we use vascular lasers to decrease the vascularity. Now, we have the choice of two different lasers for vascularity. One is the V-beam laser. The V-beam laser is the gold standard for anything vascular, anything that's red. It's highly effective. This laser was designed for this purpose, sole purpose in mind, to treat vascularity. It's a laser we use for port wine stains or any kind of vascularity, rosacea, so forth, so on and so forth. A second laser I use is an Nd:YAG laser, specifically the Cool Touch Vari laser. This laser is better for larger caliber blood vessels like the blue and the green blood vessels. Etiology number two, true pigmentation. So we talked about vascularity, which gives you a purple hue, gives the appearance of dark circles, but true pigmentation is brown. It's a brown color. And so we actually look for that. And if I can find brown color under your eyes, the treatment for that is a pigment laser. Now, there are many pigment lasers available. Usually it's a Q-switch laser or a pico laser, whether it be a Q-switch alexandrite, whether it be a PicoSure or PicoWay. These are pigment lasers, and in the right hands by an experienced laser dermatologist, you can get great results within 1 or 2 sessions, wiping that pigment away. Etiology number three, crepey skin. Lots of people that have crepey skin have the appearance of dark under eye circles. What do we do for crepey skin? My go-to for crepey skin is laser resurfacing. Now, my number one choice is CO2 laser resurfacing. The results are amazing, dramatic. You do have about a week downtime. People who do not want downtime, they want to do it gradually, will use non-ablative Fraxel laser to resurface them, 3 to 5 sessions. That does also help pigmentation as well. Number four, a very common cause, hollowness, and along with that comes fat pads. This is a genetic problem. This is a problem that's not necessarily related to age. It's related to your anatomy. You can have your bones are hollow there, your orbital rim, this bone is set back. Or as you get older, or genetically, you can have fat pads, and there could be a delineation between your cheek and your eyelid skin. So a common trick we employ non-surgically, we put a filler. So I put a filler either to bring the hollow eyelids up or to camouflage the fat pad, the junction where the fat pad meets the skin, by blurring that junction, your eyelids, and having a smooth transition from your cheek skin to your eyelid skin. You're going to look better. You're going to look younger. Lastly, it's worthwhile to explore whether you have allergies, because often people who have allergies, whether it's seasonal allergies or asthma or hay fever, and they rub their eyes, they get crepey skin. They also get lichenification or thickening of that skin, which looks leathery. There's something in dermatology we call Denny Morgan lines. We can actually know right away if somebody has atopic dermatitis or asthma because they have these very characteristic lines on their lower eyelids. So it's important to pay attention to that because you do have history of that. It's good to be able to come with a medical regimen to control that, whether it be antihistamines, eye drops, nasal sprays, and so on and so forth. I hope that you found this presentation helpful. The treatment of dark under eye circles is complex, and it really requires the attention of a well-versed dermatologist who really has access to everything that I told you about, and he can pick and choose the right combination of things for you. Signing off, Dr. Cameron Roxar.